taking care of your teeth is more than just making your smile look pretty or preventing cavities. Those are important things, but much research has begun to show and continues to show that infections in your mouth are directly linked to certain systemic diseases like cardiac, stroke, Alzheimer's, diabetes, complications and whatnot. So keeping your mouth healthy is a good investment. We want our patients to understand the connection between dental health and systemic health. We have videos, we have flip charts that we show, we have lots of conversations with them, and we also link that to photos that we take of their dentition and have a conversation about how improving the health of the gum tissues, for instance, can be a great benefit with respect to effects on some of these systemic conditions. When you start treating your mouth as part of your holistic body, you are becoming more self-aware, and it just cascades in such a positive direction. You know, patients see their dentist usually more frequently than they see their physician, and having our team being a really good coach and player in their quest for being as healthy as possible, we're a good checkpoint for them to come in and get on track and stay on track. When we see a patient who has signs of a systemic condition manifesting in their mouth, we first inform the patient that we have a suspicion that there's something going on here, and it's a good idea for you to maybe have a conversation with your physician. Many patients are very thankful for that and then go on and have that conversation. There are several signs in the mouth that will show that somebody's at elevated risk for a systemic health condition. Diabetes, for instance, can change the ketones in your mouth, which will change your breath aroma. And then also issues like the inflammation in your gums are an indication that there could be germs getting into your system that could be affecting cardiac issues, memory issues, or even stroke or diabetes. When patients have completed the first phase of treating gum issues, a lot of our patients have reported to us that they actually feel more energized. They can tell that their mouth feels cleaner, that their tissues around their teeth feel tighter, and that they actually feel like they have a little bit more pep. When you establish good dental habits early in life, you're setting yourself up for so much success. Think about how many less treatment visits you'd have. If you're coming in for regular prevention visits and you're doing a lot of great, you instill not just toothbrushing habits, but eating habits and snacking habits that make sense, you can avoid so many of the more difficult procedures that may be down the road if you otherwise did not have good habits at home. Having the same dentist over many years of your life gives the perspective of seeing any subtle changes that maybe crop up, that if you're bouncing from one dental office to another, they don't really have that sense of history. We take photographs on our patients at pretty much every visit, so if something comes up, you can compare to an issue, hey, is that new, or how long has it looked like that? And the continuity of care is much greater going to the same dentist along the way for many years.